I'd like to start by introducing our panel of experts today. Welcome to Medicare 101. Each of the people of our panel of experts are experts on their area of Medicare, and I want to introduce them. First, we have Brenda Munson. Brenda is the project coordinator and coordinator of volunteers for the North Dakota Senior Medicare Patrol. We next have Apryl Davenport. Apryl, there's Apryl. Apryl is the regional volunteer coordinator for the North Dakota Senior Medicare Patrol. We also have Meagan Nelson. Meagan, give us a wave. There she is. Meagan is the corporate quality and compliance nurse with Caring Edge Division of Edgewood Healthcare. And last but not least, we have Jenna Perlichek. Jenna's going to give us a wave. Jenna is the director of outpatient therapy services with Caring Edge. Also, she's in Minot, North Dakota. And myself, I'm Kim Brackey. I'm Regional Sales and Public Relations Director for Edgewood Healthcare. I'm based out of Pierce, South Dakota, where it is snowing. And I know many of you are also in the snow. So for those of you not in the snow, we wish we were with you. I am going to turn it over first to Brenda and Apryl. They are going to talk a little bit about Medicare and what they have everything to offer in that area about Medicare 101, what Medicare healthcare fraud. They have a lot of things to talk about. So I'm going to turn it over to you guys.
Okay, thank you, Kim. Good afternoon. As Kim said, my name is Brenda Munson. I am the coordinator of volunteers and program coordinator for the North Dakota Senior Medicare Patrol. We shorten it up and say NDSMP. I've been working with the SMP program for about 11 years now, and this is a program that's very dear to me, probably because I am retirement age and I can see what's happening, but it frustrates me so when I hear of the scams that the fraudsters are and how they're taking advantage of the seniors in North Dakota. So as my job as a coordinator of volunteers, I'm responsible for overseeing and hiring and training the regional volunteer coordinators, or RVCs. We have acronyms for everything. And so then this brings me to introduce Apryl, who is one of North Dakota RVCs. Apryl?
Oh, Apryl, you're muted.
I think my husband would love to have that girl go there. Anyway, Apryl here. I used to teach elementary school for 28 years. I was an advocate for children for those many years and decided that, you know, when I turned 65, maybe I needed to switch and become an advocate for seniors, which, you know, is very important, as Brenda said. I've been working with Brenda for about 6 years now and really enjoy it. I truly miss being face-to-face with the beneficiaries, because that's kind of our role, is to get out there and connect with them. But we're looking forward to today.
Okay, so moving on then. So what is SMP? For those of you that maybe are not familiar with it, SMP is the Senior Medicare Patrol Program. It's a nationwide program that helps Medicare and Medicaid beneficiaries avoid, detect, and report healthcare fraud. So they both protect beneficiaries as well as the integrity of the programs by recovering and avoiding, excuse me, the billions of dollars that are typically lost to healthcare fraud every year. And we're talking billions of dollars. It's significant. So the SMP programs also recruit and train volunteers. We look for volunteers within the community, because who better to hear about fraud than someone that is trained and educated within your community. And with all the fraud out there, we are so leery to answer our phone or to open an email. So again, if you know that person in the community and they're sharing information with you about Medicare fraud, you are more than likely to maybe listen and follow some of the things that we like you to do. So as I said, there is an SMP program in every state within the United States, and as well as there's like the Virgin Islands and Guam and some other ones too. So the information though that I'm sharing today reflects on the North Dakota Senior Medicare Patrol Program. So these programs are federally funded by the Administration for Community Living. The North Dakota program is supported by the North Dakota Center for Persons with Disabilities, which is where I'm employed, and then we are located on the campus of Minot State University. So I want to just share a little bit of information today about, or April and I will be about basic Medicare information. We call it actually alphabet soup of Medicare because there's A, B, C, D. So it is kind of an alphabet soup. And then some current Medicare fraud that we're seeing in the state of North Dakota. And I'll tell you what, it is really prevalent right now. We have gotten many, many calls of people giving out their Medicare numbers. So and just a few facts about North Dakota. You know, we are an aging state. We hear that all the time. So the last census, which was in 2010, indicated that about 15% of North Dakota's population was 65 years of age and over. The trend data suggests that by 2030, approximately 25% of North Dakota residents are going to be 65 and over. So in 2018, there were about 97,000 North Dakota citizens who were enrolled in Medicare, and that can be age-related, you know, turning 65, or it can be through a disability. This is about 13% of the state's entire population, so that, again, is pretty significant. If projections hold true over the next 20 years, the number of North Dakotans that are eligible for Medicare is going to increase really significantly. So with more enrollees and a lot of people living in isolated areas and regions, and especially now with the COVID, the chances for Medicare billing confusion, the errors, the fraud, the scam artists reaching out, that also is going to increase significantly. So with that said, let's get on to talking about the alphabet soup of Medicare and picking apart those parts. And I'm going to have Apryl start with that.
I'm just going to give you a brief overview, not an overview, but just a definition of just basic Medicare. And because Medicare is the federal health insurance that all of us are eligible for when we turn 65. There are those that are under 65 years of age who are disabled or who have end-stage renal disease or have ALS, who are also qualifies them for Medicare, sorry. But most of us get our Medicare through the original Medicare, which is Part A and Part B. Often then we have a supplemental secondary insurance plan, and then we also have a prescription drug plan. Or you can just go with a Medicare Advantage plan. But a lot of this depends on what your needs are, or the coverage plan that you want that will suit your needs the best. And so a lot of these will, your decision on which way to go with Medicare or Medicare Advantage depends a lot on your needs and the services that you need to have provided for you.
Thank you, Apryl. So applying for Medicare, it's automatic for those receiving Social Security benefits already, or the railroad retirement benefits. There is an initial enrollment period. You get a package that's usually mailed about 3 months before you turn 65 or the 25th month of your disability. Excuse me, I'm going to shut this down. I got a cough, so hold on. Seriously. I don't have no coronavirus. Seriously. It's every time I speak, I get a tickle. So if you are already receiving Social Security benefits, for example, getting early retirement, you will automatically be enrolled in Medicare A and B without an additional application. That will happen automatically. You will receive like an enrollment package, an initial enrollment package that comes with your Medicare card and lots of other information that might seem overwhelming. This usually comes about 3 months before you turn 65, because coverage for Medicare begins the first day of the month when you turn 65. The Medicare card is going to show you your ID, and that's going to be your that 11-digit random number and letters, and you're not ever going to memorize it. That was changed, remember, from the Social Security number a couple of years ago. And it also shows on that card the Medicare coverage dates for Part A, which is hospital, Part B, which is medical. And if you choose a Medicare Advantage plan, instead of going with original Medicare A and B, then you will receive a separate card from that Medicare Advantage plan. You won't need to carry your original Medicare red, white, and blue card. You're going to carry that Medicare Advantage card instead. And that's the one that you use to get your health care services and supplies. If you don't want Part B, like I'm still working, so I am not getting Part B. All you need to do is follow the directions on the back of the Medicare card. It'll tell you how to opt out of that. There's also several enrollment periods to be aware of when you're applying for Medicare. So one of them is the 7-month initial enrollment period. That is, again, the one that's 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. Then there's a general enrollment period. So if you don't sign up for Part A or Part B when first eligible, you can sign up January 1st through March 31st each year, each following year. And the coverage then begins July 1 of that year that you signed up. Then there's the special enrollment period. So if you don't sign up for Part A or B when you're eligible, say because you're covered under a group health plan like I am, then I can sign up anytime during the 8-month period that begins after the employment coverage is going to end, or even while I'm still on it. If I know I'm going to retire, I would go ahead and sign up for it. But if you miss your enrollment period, and if you apply after July, you can't enroll again till the next January. And so then that coverage starts the next July. And along with that comes a penalty that will be a 10% penalty for each year that you did not sign up for Medicare when you were eligible, either be it by age or if you were under an employee plan. But that penalty will be assessed for every year that you did not sign up. Apryl.
We are currently in the medical annual enrollment period right now. That runs from October the 15th until December the 7th. And all beneficiaries that have Medicare are eligible at this time to go and update, or if they want to switch their plans to a different drug plan or to a Medicare Advantage plan, this is the time to do it. Once you switch, the coverage doesn't begin though until January 1 of next year. But it's very important that whatever drug plan that you have decided on by December the 7th is the one that you will have then starting January 1. So if you have been working with someone and you've decided on plan A and something has changed in your health status and your medication has changed, you can go back in and apply for a different, and look at the plans again and choose a different one. So it doesn't matter how many times you change, as long as you look through the plans very carefully with a counselor. And usually that's with the State Health Insurance Council, that the plan that you have on December the 7th is your final plan that you're going to have then for the 2021. There are 4 parts to Medicare that we try to teach our beneficiaries about, and it covers so many different types of services, and that people need to have options, and this provides them. You have Part A, which is your hospital insurance. You have Part B, which is your medical insurance. You have Part C, which is your Medicare Advantage, and then you have Part D, which is covers your prescription drug plan. These are 4 distinct parts, and you should be very aware of what each part covers.
Okay, so Part A of the alphabet soup. So as Apryl said, that is the hospital part, the hospital insurance. It covers inpatient care, which is a semi-private room, your meals, any kind of nursing, general nursing care, the drugs that you take while you're in the hospital, any other hospital services like labs, x-rays, and then supplies, all part of an inpatient treatment, okay? It also covers skilled nursing, which is, and that will be 100 days that they will cover after the 3-day inpatient hospital stay. And I want to stress inpatient hospital stay. So many times now, so many beneficiaries are being admitted as observation or outpatient, and honest to goodness, they can be in the hospital for 5 days under this status, may get sent to rehab, may get sent to a skilled nursing, like a nursing home. And what happens is their Medicare will not pay for those 100 days then that they should be entitled to, because they were not an inpatient. So it's so important for the beneficiary to always ask, am I an inpatient? Because if not, you might need to visit with the doctor about it to see, or the hospital discharge planner, to see if there's something that they can do to intervene so that you can be an inpatient. They also cover home health services as well as hospital services. So for most people, the Part A premium is free. If you've worked in the US for at least 10 years, that gives you the hours, the credits that you need to get free Part A. And it's financed normally through like payroll taxes. So that's why it's kind of linked to your years of work. If either you or your spouse don't qualify for a premium free Part A, you may still be able to purchase that by paying a monthly premium. The amount of the premium is prorated for how long you or your spouse worked in a Medicare covered employment. So, you know, if you work 2 years or 5 years, it will be prorated. So Social Security is the agency that determines if you have to pay a monthly premium for Part A. If you have to buy it, the full cost of it is $458. That's the 2020 dollar amount, and that more than likely will change with 2021. I don't have that with me, but that would be the full cost. And then, like I said, if you've worked some years in a Medicare covered employment, then they would prorate that accordingly.
Brenda, can I jump in? We do have a couple questions that
Yes.
I just want to make sure we don't, that I want to make sure we ask. Julie asked, my husband is turning 65 in March. He has retired, but is covered under both my employer's insurance and he has kept his federal health insurance. What should he do?
Well, as long as he's covered under a comparable health insurance plan and it has prescription drug coverage as well, they can stay on that, because you know, and it just depends. I mean, if is he going to continue to be covered under his, is his previous employer going to continue to pay that health plan for him?
It looks like he has retired, but is covered under both my employers and he has kept his federal health insurance.
As long as he has comparable insurance, he is okay. The time that he wants to, the time that she wants to, the wife wants to retire, and if he wants to drop that employer plan, that would be the time then that he would want to enroll.
Okay.
Okay.
Hopefully that answers. I'm going to ask you one more and then I'm going to let you get on with the rest of your presentation. Brad M asked, if you are already enrolled and do not plan any changes, is there any action that needs to take place? Will enrollment just roll over for the next year?
Is he talking the Part D prescription plan?
He did not specify.
I'm thinking, because normally once you're in like the Medicare and the Med Sup plans, you usually kind of stay with that. If he's talking about the prescription drug plan, here's the deal. Last year, I saved one of my beneficiaries that he was, I want to say he was on a lot of meds. He was on inhalers and for COPD, and he was on insulin. I saved him $38,000 because I found a better plan. A lot of times the plan that we always ask people to always run a comparison or do a comparison, because the plan that you're on this year, even if nothing changes, if you're on the same meds, they may knock off some of those meds that they're going to cover. The premium price may change. So it's always good to run the comparison just to make sure. And
he did
a lot
specify
of times
it was a Part A, B plan is what Brad wrote back.
Oh, no, then normally, no, that will automatically continue on until he decides that he wants to change it, if for some reason he wants to. But most of the time when people get into that original A, B, and if they've got a Med Sup plan or Medicare supplement that picks up that 20%, usually people just stay on that and it just rolls over from year to year.
Got it. Thank you. I'm going to let you get back to your stuff. I think we don't have any more open questions.
Okay. I'm going to let Apryl jump in with Part B.
Okay. Part B is your outpatient health care or health insurance. And this is one of those that covers a myriad of many observation stays, your doctor visits, if you have, come on, Brenda, DME.
Durable medical equipment. Yep.
Durable medical equipment, wheelchairs, walkers, those kind of things. If they are ordered by your provider, then they are covered under Part B. What's nice about this Part B too is that it has many preventative benefits to all of us, besides just shots and lab tests, but it also does multiple screenings for things like glaucoma, bone mass measurement, cardiovascular disease, colorectal cancer, diabetes, your flu shot, your pneumococcal, smoking cessation, pap smears, mammogram, all those are covered under this preventative benefit part of Part B. So it's very important that, you know, use those, because the earlier you detect something that's happening in your body or whatever, the faster you can get care and treatment for that. This little book here that I've always thought was just so, thick and full of words on words on words is a really good resource that we probably should read more of it, because it spells out all those different benefit services that you get with Part B. So make sure you read that. There's also a Welcome to Medicare physical exam that you get when you first initiate your enrollment into Medicare. And it is a very comprehensive health exam that it's a kind of a baseline, I guess you might call it, but you need to do that at least 12 months after you've enrolled. And it's not something you can get later. You get wellness checks annually from your provider, but you can't get that comprehensive Welcome to Medicare physical exam. Part B is, unlike Brenda's, there's a premium last year that was $135.50. This year it has gone up to $144.60. So a little bit of an increase there. But then also we have to say that if there are Medicare beneficiaries out there who are finding it difficult because they have limited income or resources, they do qualify for help, or they can qualify for help, and that can offset that cost of the premium. I think I've covered all those.
Okay. I see we're going to run through the last couple quickly here, because I want to get into the frauds before we run out of time, and I don't want to encroach on anyone else's time. So the Part C is the Medicare Advantage. And so that usually encompasses the Part A and Part B. And a lot of times it will also provide Part D prescription coverage. These are private plans run by insurance companies. So I want to mention one thing about the Medicare Advantage. So there's a lot of advertising out about the benefits of switching over to a Medicare Advantage plan, because, oh gosh, they offer services like eyeglasses and hearing aids and dental exams. And the extra premium sometimes pays for those extra benefits. But if you're signing up for one of these Medicare Advantage plans, please, please, please ask what exactly is it covering for those extra services. A lot of times those Part C plans only pay for exams, for dental exam, vision exam, hearing exam, for those extra services and benefits. What you want to find out from those Part C, do they actually cover the product, like dentures, eyeglasses, hearing aids? Because a lot of times they don't, and it's very deceiving, and you can get into a Medicare Advantage plan and then find out that it's not really what you were thinking. So the thing with the Medicare Advantage plans is, again, you have to be sure, as Apryl had mentioned, you have to be sure that that Medicare Advantage plan is offered in the geographic area where you're living. And so we do that by putting in like your zip code, and then that will let us know if there is a Medicare Advantage plan within your area. So Apryl.
Okay, I think I'm on D now, right?
Yes, you are.
We're on the prescription drug coverage. And there's a word in the prescription drug community that's called a formulary, which has always sort of thrown me. But the formulary it's a drug plan that covers certain drugs in their plan, and they can be either various tiers, which can vary the cost of your drugs. So it's really important that you go and do the open enrollment, because one of your drugs that may have been pretty low cost or maybe no cost this year on the formulary for your plan may have jumped up, and you want to be able to get the best, the best price. So it's very important that you check out the tiers of the medications you're taking and get the best in the lowest range in your costs. The thing about Part D too, I should have prefaced that before, is that Part D, to get Part D coverage, you must be enrolled in A and B of Medicare. And like Brenda says, you have to live in the service area. It's very important that if you don't sign up, remember about that penalty that that you're going to end up paying. So no, okay, yep, that's right. So make sure that you get a Part D plan when it's time for you to, or you're going to have a penalty that you're going to be charged.
Thanks, April. So the last thing, wrapping up that Medicare alphabet soup. So I threw in a Part E. Really, Part E is your effort. The Medicare can help cut back on overall health costs. Just make sure you don't miss out on those important enrollment dates when you're eligible, avoid coverage delays, and always check www.mymedicare.gov for the most up-to-date information. So now I want to move on to fraud because that's what's really near and dear to my heart. So, you know, our biggest motto with SMP is to guard your card and be aware of scams. In 2019, the SMP projects reported about $2.4 million in expected Medicare recoveries. So that's not even the overall what the fraud was. This is an expected recoveries that SMP programs throughout the United States have helped to curtail. So, and you know, and then there's savings to beneficiaries too, not just to the Medicare program, because a lot of times if these people are scammed and Medicare doesn't pay for it, a lot of times the patient will be billed, and they're so afraid that, you know, if they don't pay that dollar amount, then they're going to be turned over to collection. It's going to ruin their credit rating, and there's just a lot of stuff. So information that the scam artists want most of all: Medicare number. They want your name, address, date of birth, social security number if you're willing to give it. Some fraudsters, I just want to share this, is they even troll through the obituaries, right? They get names and addresses and dates of birth, and then they can actually purchase a person's social security number on the internet, sometimes for as little as $10. So that's one reason, really, when you're writing an obituary for a loved one, leave off their date of birth and the address, because that is pertinent information to the scam artists, and they really do troll the obituaries. So some scam warning signs: someone might say to you, you need a new Medicare card that's laminated, or it has a chip. It's a limited time offer, sales pitch, you know, free information postcard, or you've been pre-approved. And they usually want you to make that decision right away. They don't want you to wait. They want you to make that decision the spur of the moment, so that they can actually catch you in the scam. The one that's going around the most now in the state of North Dakota, and I can't tell you how many calls that we've had. So scammers are seeking personal information like the Medicare number. What they're doing is they'll say, you know, the call might go like this: hello, this is Medicare calling. Medicare is offering you a new laminated card, or how about a card with a chip in it? We need to have your old Medicare number so that we can send you a new Medicare number. So you need to verify your number. Tell me what your number is. Oh, and by the way, are you having pain? You're eligible for a free back, knee, ankle brace. These braces, honest to goodness, they're neoprene braces that you can buy at Walmart or White Drug or wherever for $10. Had a beneficiary that was, let's see, Medicare was billed $2,611 for those braces. She got them. She actually got them. A lot of times they don't even get them. Then her Medicare supplement insurance was billed $1,611. And so we will try to, we are filing fraud on that one, and we will try to recoup those dollars. But again, it just puts the beneficiary in a bad position, because if it gets denied by Medicare and Blue Cross, then the beneficiary could potentially be responsible for it. So, you know, and everybody's afraid to admit that they've been taken by a scam. Don't be afraid. We had a professor here at the university on Medicare, gave out her Medicare number. So it happens, and we understand that, and we will never ever judge. So, again, so I'm going to let Apryl talk a little bit about some of the other scams that are going on in the state, and then we will wrap this up.
The one that I want to share with you is that it's not always a scam so much as it sometimes can be overlooked if we don't, as beneficiaries, look at what we call our MSN, which is your Medicare Summary Notice. It's the little form that you get every 3 months that says this is not a bill, but lists all your services that you've gotten through Medicare or through your providers. And what's happened is that we had a lady up the road that her appointment was canceled because of a water main break in the clinic. And so she didn't go in. They called her and it was okay. She didn't go in. But yet when she had her Medicare Summary Notice, it had on there that there was a charge for an office visit. And we, you know, as we try to make them savvy, she went and contacted them and said, remember, this was the water main break. And the lady was just very apologetic. And it was just probably one of those that they overlooked. But you have to look at those MSNs to make sure that you're not charged double, or that, you're charged for something that you did not receive. So it's very shrewd to be rude and, go in there and face them and ask the questions if you don't believe it's true. And this is what, we need to have advocates for our parents who need, somebody behind, to support them. All I can say too is shred, shred, shred. Anything that has your name and address on it, shred it, please. Another thing that I usually tell my seniors when I'm out visiting with them in their senior centers is your pill bottles, because there are so many dumpster divers. You have to make sure that you take off this label. It has a lovely little barcode on it there, that dumpster divers can use that. And so you've got to make sure that you protect yourself, take that label off that pill bottle, and then chuck it out. If it sounds too good to be true, it probably is. So please be, I always say we, really scare the living daylights out of our beneficiaries when we go to senior centers. But what we want them to do is just to be really savvy seniors. And if they suspect a call that, they don't recognize the number, then they don't need to answer it. Wait for the answering machine or the, voicemail to pick up. And another one that we had tried to get them to do is to call the do not call registry, so that they don't keep getting those robocalls, because those can be very unsettling to them as well as seniors. I love going to the senior centers because there's so many stories. There's not a senior center that I have not been to, or an event that we don't hear these crazy, crazy, horrendous stories of how scammers are out there preying on these, these wonderful people in North Dakota. So yeah, we need to be savvy seniors and empower our seniors to protect themselves.
Okay, so in wrapping this up, don't be a target of healthcare fraud. Protect yourself from Medicare errors, fraud, and abuse. Be a savvy senior. Learn to detect those potential errors, fraud, and abuse by watching that Medicare summary notice. And I was just being very aware of, jot on your calendar when you saw the doctor. Did you have blood tests? Did you have x-rays? Just that kind of information. So when you look at that Medicare summary notice, like 3 months later, it'll kind of jar your memory. And if you suspect that you've been a target of fraud or abuse, report it. Report it to, you can call 1-800-MEDICARE, or you can contact North Dakota Senior Medicare Patrol to report anything. We are more than willing to help you, and we'll always, if it's something that may not absolutely pertain to healthcare fraud, we work very closely with the Attorney General's office as well. We refer cases back and forth all the time, so we would be more than happy to help you. Thank you.
Thank you, Brenda and Apryl. A quick question. We have 2 other questions that I'm going to hold till the end, till we have a little more Q&A time at the very end. If a caller or a person watching right now lives outside of North Dakota, and they live in South Dakota, Minnesota, Wyoming, Idaho, wherever they live, is there an Idaho Medicare Patrol, or who could they contact in their state?
They can. There is a Senior Medicare Patrol in every state in the union. And so they can, you can just actually put in Senior Medicare Patrol programs in the United States, and it will give you a list of the one within your state. And if you don't have a computer that you have access to, what you can do is call your local Attorney General's office. More than likely, they have the access information for them.
Wonderful. That is good information. We're going to segue into the Caring Edge side of things and what Medicare covers. One thing I want to mention quickly that is a common misconception that we run into with assisted living, memory care, even independent living. With Edgewood, we often run into people think that, oh, I have Medicare, so Medicare is going to cover my assisted living stay. And Medicare does not ever come into play in payment for anything at assisted living for your room and board or the actual cost for your monthly cost. Now, Jenna and Meagan in a little bit are going to talk a little bit about some of the things that it can cover if you happen to live at an assisted living that has, and you're receiving some therapy services, but please keep in mind that Medicare does not pay for the room and board for assisted living or memory care. A few other options for payment would be if somebody has long-term care insurance, or if they are on Medicaid. Most of our communities within Edgewood do have Medicaid beds available. They may not be available, they may be full right now, but we have Medicaid beds. Veterans benefits are also an option. And then of course we accept private pay. So I just want to mention that because that is a common misconception that people seem to think that Medicare will cover their room and board at Edgewood or another assisted living. So just want to mention that. Jenna, I'm going to turn it over to you to talk a little bit about therapies and services that are Medicare approved.
As Kim said, I am Jenna Perlichek. I am the director of outpatient therapy at our clinic in Minot. I have my master's degree in occupational therapy. I've been practicing for roughly about 8 years, and the majority of that has been with the older adult population. So that's definitely where my passion lies. So I think a lot of times when people think of outpatient therapy, it's an acute or surgical need. So maybe you just had a knee replaced, hip, shoulder, those kind of needs, which definitely is part of outpatient therapy. But I think often for this older adult too, where we forget is what about some of those chronic issues, back pain, knee pain, complications from arthritis. Those are all things that you can seek outpatient therapy for as well. It doesn't have to be a new issue. Maybe it's an old injury that's now flaring up and you're having more issues. When it comes to outpatient therapy, that is going to be part of your Medicare Part B benefit, as it was already discussed. Oftentimes what I've seen since I've been with Caring Edge is a lot of times the older adults will have a secondary insurance as well. So what you'll see with that 80-20% is your Medicare Part B will cover that 80%. And then any sort of secondary insurance you have will pick up that 20%. So the awesome news is it's often a service that is no out-of-pocket expense for the individual. Some therapies that you will see on outpatient would be a physical therapist, occupational therapist, and speech therapist. You don't necessarily need a referral from your doctor. What Medicare requires is that a doctor is signing that plan of care in a timely manner and that the therapist is in good communication as that plan of care goes on. So if you have any questions about what therapy maybe would be best for you, you can always call an outpatient therapy clinic and ask some of those questions and then go from there. So can I have therapy forever? Like I said, with those chronic conditions, sometimes it is an ongoing and long treatment time for that. So what Medicare does is it kind of has a little bucket of what we call a soft cap. So you have roughly a little over $2,000 that Medicare will put towards our occupational therapy. And then another bucket of a little over $2,000 that goes between PT, physical therapy, and speech therapy as well. So that doesn't mean that after that $2,000 is done, that you have to stop therapy. That's just that we need to show that it's medically necessary for you to continue to receive those services, and that your insurance will then continue to cover it. Another great thing about Medicare is that they now are looking at maintenance or preventative a lot more seriously. And with this aging group, with comorbidities and just the natural kind of decline as we age, it just gets harder and harder to do different things. And so the great thing is we can do rehabilitative therapy, which would be often after a surgery that maybe you've declined and things are more difficult to do. We can help rehab you back to your prior level. But also there's a benefit of maintenance therapy. And that's where a skilled therapist is needed to see you routinely to help maintain your level of independence. So it's not necessarily that we're wanting to make a whole lot of improvement, but we just want to maintain your level of independence, especially with a lot of those degenerative disorders like Parkinson's, which are going to have a gradual decline in your skills and the things you're able to do. So a therapist can help somebody with Parkinson's kind of slow down that progression. Any questions that you ever have when it comes to outpatient therapy, I don't think it's an issue to call the clinic. They can always run your benefits too before you decide to go in, to make sure that you don't have any out-of-pocket expense. And then I'm going to let Meagan talk a little bit more about therapy with home health.
Thank you, Jenna.
Hi guys, I hope you all are having a wonderful afternoon. My name is Meagan Nelson. I am the Corporate Quality and Compliance Nurse for Caring Edge for both home health and hospice. I have been doing home health and hospice for almost 8 years now. Wasn't what I originally planned to go into, and I got into it kind of out of a fluke and have loved it. So I really do love what I do and love home health and hospice. Over the years, there's been lots of changes. It's continuing to, evolve, but couple things. So what is home health and what is hospice? Home health, the main goal of home health is to provide some assistance to a patient, whether that is intermittent skilled services, physical therapy, occupational therapy, skilled speech therapy, medical social services. So what that means is if you have any wounds that need managed by a skilled nurse, those are things that home health can do. Let me jump back just a little bit. So what do you have to do to qualify for home health? One of the biggest things in order to qualify for home health is you have to be under the care of a doctor. You must be getting services under a plan of care created and reviewed regularly by a doctor. You also must have some type of skilled need. So what that means is some type of skilled needs such as wound care, catheter care, education is a big one, and then physical therapy, occupational therapy, things amongst that nature. The other really big thing about home health is you must be homebound. So what that means is it doesn't mean you can never leave your home. What that means is it's a considerable taxing effort for you to leave your home. So it is easier for a skilled nurse or physical therapist or occupational therapist to come to you versus you going out to receive those services. So being homebound, again, doesn't mean that you can't go to doctor's appointments. You are allowed to go to doctor's appointments. You're allowed to go to religious services. It just means that it is a taxing effort for you to do those things. So once you meet the criteria for home health, then you'll be evaluated by a nurse or a therapist, and they will discuss the services that are available to you. Depending on your needs, if a nurse is needed for wound care, they'll set up a schedule and frequency for them to come in and take care of that wound care. Medicare does cover intermittent skilled nursing. It does not cover 24-hour care. So that is something to remember, is that it just covers intermittent skilled nursing. So the nurse will come in throughout the week. It will cover physical therapy, occupational therapy, speech therapy, medical, social services, and intermittent home health aid services. Now, if you are in an assisted living, home health will not cover a home health aid because those services are being provided by the assisted living majority of the time. The other thing that you need to know about home health is you have a 60-day benefit period once you qualify for home health. And what that means is at the end of that 60-day benefit period, depending on how well you are doing, we have to say, okay, they're good to be discharged, or we need to recertify them for these skilled needs. With home health, we always have to show why we are there and what our goal is. Our goal on home health is to get you better, to get you back active, to get you back to an independent level. So that is kind of the goal of home health. Like Jenna said, we are developing and they are moving more into maintenance programs. And those things are available on home health as well for therapy and long-term skilled services. Now, I'm going to jump over to hospice really quick since we've only got a few minutes left. What is hospice? There is a huge misconception about hospice, and hospice is actually one of my favorite services to provide, because hospice is, we're there to be there for you as a patient as a whole, not just your physical well-being, but your emotional and spiritual well-being as well. To qualify for hospice, you have to be under the care of our hospice medical director and your doctor, and they have to certify that you have a terminal illness. And what that means is that if your illness runs its normal course, that you have a life expectancy of 6 months or less. Now, the big misconception is that when you get on hospice, you have to be what we call actively dying. That is not true. Our goal is to get patients on hospice sooner than later, because we want to be in taking care of these patients so that we can provide comfort care and that we can be there as symptoms progress and things progress, so that we can be there to provide comfort and education. Hospice and home health are covered 100% under Medicare. So there are no out-of-pocket expenses for hospice or home health. With home health, you are in charge of your medications, but those will be covered under your Part D. And with hospice, any medications related to your hospice diagnosis or symptom management are covered by the hospice agency. Hospice also provides any DME equipment that is needed, and anything else to palliate any comfort symptoms. Hospice also provides us a nurse, a social worker, a spiritual care coordinator, a volunteer coordinator, which is unfortunately kind of restricted right now due to COVID, and also our hospice aid services. So with hospice, we have more leniency as far as how often the hospice aide can go in to take care of patients and help them with ADLs, bathing, showering, things amongst that nature. Our goal with hospice is just to be there to provide comfort care, knowledge, and be there for the family as a whole. With hospice, again, you have certification periods. If you've never been on hospice before, your first certification period is a 90-day certification period. And what that means is once you qualify for hospice, you are qualified for 90 days. At the end of that 90 days, we have to say, yes, they are still hospice appropriate, and this is why. Once we once we justify why you still need hospice, then you get a second 90-day benefit period. At the end of that second 90-day benefit period, you can still qualify for hospice as long as we are showing that you're meeting certain criteria. And also at the end of that 90-day benefit period, you have to have a face-to-face done by our medical director, who will also support our findings, saying, yes, this is why the patient is hospice appropriate. And then from then on, you get unlimited 60-day benefit periods as long as we can justify the need for hospice. So I know I've run out of time. I hope that provides a little bit of information about home health and hospice. Thanks, guys.
Thank you, Megan and Jenna. Brenda and Apryl, if you guys can put your cameras back on too. I just want to open it up for the final questions and answers that have come in, and we'll try to get through all of these. At the end, we are going to share everybody's contact information. So if there's something specific that you want to ask that you didn't feel comfortable asking on today's session, you can always contact them directly. The first question that I want to ask is, Juliet asked, thanks for answering my first question. A follow-up. If I retire early at age 63, we would both be covered under his federal plan, which we would be paying for. When should we both sign up for Medicare? And I think that would be probably you, Brenda, if you can answer that one.
Yep. So Medicare, they'll be eligible for Medicare when they turn 65. So the first day of coverage would be the first day of the month of the month that they turn 65. So I would say 3 months before, start getting that in order before you turn 65. Okay.
Thank you for that one. And then are there any deductibles for Part B insurance?
Yes, there is. Catch me off guard. If you want to call, I can look up that information. You can call me later and I can get that. But yes, there is. There are deductibles for that. So Part B only covers 80% of whatever service, like for the doctor or the DME or whatever. That's why most people carry a Medicare supplement to pick up that other 20%. Sometimes with that 20%, you might have a little bit of a deductible. There are plans where you don't, but that is something that you want to take a look into. But yes, most of the time, the Medicare B only covers 80%. You will always pay 20% out of pocket.
Thank you for that one. Another question from Norma is Part D plans who will help review your meds for the best plan. I think and then she says pharmacy seems too busy. So maybe who to talk to about your Part D plan, since the pharmacy seems like they're too busy to visit about that.
Yep, and most of the time they are, because they're also short of staff. So call S&P, or you can call the state health insurance department. And I should have that number, don't I? And I do not have that right now. So I will look that up, though, if you want to go on to another question, and then I can get you that information, okay?
Okay. Dawn was wondering, is there an organization for North Dakota residents that helps choose the best plan for them as Shine does for South Dakota residents? Is anyone familiar with, I know Shine exists for South Dakota, but Brenda's already looking something else up. So maybe we'll come back to that one to see if there's another organization. Apryl, do you happen to know if there's something like that for North Dakota?
No, not an organization like that. I know that sometimes your Commission on Aging Services areas do have counselors there in their offices that, do assist people to pick out a plan. But, with this virus, we've been pretty shut down and we're doing everything kind of virtual. So, but no, I don't know of any program.
So possibly for North Dakota, the Commission on Aging Services, you said?
They might, if they have counselors there.
Okay. Hopefully that helps. That Vicki had a question about regarding open enrollment to go from one Medicare supplement plan to another, not Advantage. You usually have to medically qualify. Is that correct? You can go from a supplement plan to an Advantage plan or vice versa without medically qualifying, correct? And I see Brenda nodding, so I'm going to let you answer that one.
That is correct, yes. And I want to just stress again, if you for some reason did not sign up for a Medicare supplement plan when you were first eligible, you decided to wait, you're going to tough it out, you're healthy, you don't think you need it, and then all of a sudden you need it. Now you are going to have to probably have a physical. You can be denied coverage if you do not sign up for that coverage during that initial enrollment or the special enrollment period. So that's something really important to remember. And as far as like switching plans in between as well, you sometimes may need to be prior approved before they will accept you. Yep. And back to that insurance, to call North Dakota State Insurance Department for help with enrollment for Part D, 701-328-2440. And you will actually need to make an appointment. You'll have to ask for an appointment. We're not doing face-to-face this year, which is really not to our benefit or to your benefit, but we are doing them over the phone, and that works just as well. So you'll need to call and schedule.
Thank you, Brenda.
Did I answer the questions for that last caller?
I think so. Vicki,
Okay.
if that doesn't answer the question, type in something else. I'm going to go on to the next one. We only have about 3 minutes left, so we're going to try to get through as many of these as we can. We have, I don't know the name of who asked this, but what is palliative care? And Meagan, maybe you can respond to that.
So palliative care is just providing care, symptom management care. So our goal versus treatment and trying to cure an illness is to provide comfort and symptom management.
Hopefully that helps answer that. I think there is some confusion. Sometimes people wonder what that means, or with end of life. And so I think that helps answer that question. Ida Marie had said, call SHIP in North Dakota, check the back of the Medicare and You 2021 book for a phone number. Thank you. That's a good suggestion. So if anyone has the Medicare and You 2021 book, Brenda, I believe you have one that you held up a little bit. Oh no, Apryl held that up
Apryl
and said we should all read it more. Apryl, if you want to hold that up, that is the book that Ida is referring to. And if you flip it over, Apryl, I think the phone number is back there somewhere.
Yes, there is. Yep.
And
Yep.
every Medicare beneficiary should receive one of those in the mail.
Okay. So the phone number is back there. And Ida also said that Part B, deductible is $198 for 2020. We are just about out of time. So I'm going to end with just a reminder of, well, thank you to everybody who came on for this session. Thank you to our panelists, Brenda, Apryl, Meagan, and Jenna. Thank you guys for jumping on, answering our questions. I know we could probably stay on all day. Medicare is a very complicated topic that everybody has questions on, and I appreciate everybody getting on and listening to this session today, and for you guys providing your expertise. A reminder that our next session, we are going to be doing these sessions every 2 weeks, you guys, through the rest of the year. So some of you, again, are joining via Zoom. Some of you are watching on Facebook. Some people are just calling in. And I think any of those work. Hopefully you're getting the information you need. But our next session is going to be Wednesday, November 4th. And again, it's at 12 p.m. Central Time or 11 a.m. Mountain Time. And that topic is going to be moving during COVID, talking about some of the challenges, the myths, and then what the Edgewood teams are doing to keep our residents safe during COVID. We all wish COVID was over and done with by now. It's still not. So unfortunately, we're still doing our best to get through it. And we just want to talk a little bit about that next time and what that looks like for anyone that is wondering. Thank you all for joining us today. Please keep an eye out. We are going to send out an email after the fact with a survey of today's presentation, so you can just tell us how we did. Again, those emails might come from Grand Forks Marketing, which would be a no reply at zoom.us. So be sure to check your junk box for that. This recording will be available after the fact on Facebook Live, and we'll include a link to that in the email that we send out later today with the survey. Thank you all for jumping on. Have a wonderful day. I hope if it's snowing where you are, enjoy the snow. If it's not snowing where you are, enjoy the no snow. Thank you guys so much. Have a wonderful rest of your day.